Okay, awesome. Welcome, Dr. Rima. How are you?
Thank you. I'm very good, and thank you so much for having me here. I really appreciate it.
That's okay. So we've been working with TMTC for a while. They've done Hey Gorgeous. They're doing the next Hey Gorgeous. You've done a number of other shows, including the Fertility show.
Yes.
And it's going really well for you. And it's really important that I think people understand their journey with fertility.
Yes.
When they come to TMTC,
Yes.
because obviously it's such a big issue and people want to feel safe and secure. And I know, because I've not fertility, but I have been on a retreat with TMTC, and they do look after you exceptionally well.
I'm so pleased to hear that.
Yeah, right. They're great. So I know that they're going to be great with parents that future parents that want to conceive and have more members in their family. But I know you've been doing some quite major research on things like egg donors and stuff like that. So can we just preface the whole journey with what is going on at the moment in the UK?
So just to give you just to give your viewers an idea. So I'm a consultant gynecologist, and I've worked in the field of infertility and assisted conception as a consultant for more than 25 years. And this is both in the NHS, and this is in a very big NHS hospital where I used to run the IVF services, and also in the private sector where I was medical director at one of the big clinics in Birmingham. So I have been looking after patients who want to start their family or grow their family for a long, long time. And what brought me to TMTC is that I feel that there is a gap in the market that we can hopefully provide patients with safe, successful treatment, particularly in the British Asian community. So one of the big things that I noticed in my practice is that couples come through for treatment with the hope of having a baby, and of course it's not always successful. And unfortunately, we are getting a little bit older as we come forward to start our family, and that's just society and it's life. People don't realize that even though we feel we're very young, the biological clock does keep ticking. And some couples do end up requiring the help of a donor egg. Not all, some. We always look at having treatment with your own eggs and sperm first, because that is ideally what everybody wants. But in that situation where you may need to consider the option of a donor egg, the big problem is in the British Asian community is that there are very few Asian donors in the UK. So I feel that patients then look to going overseas, and then sometimes they get caught up in a situation where they don't know what to do. They travel on their own, they meet clinics where they don't know what exactly is being offered, and so we felt at TMTC that this is somewhere that we can certainly, that we can certainly offer a service to our patients where they will be looked after in a safe and efficient manner.
Okay.
The big statistic that I want to bring up today is that the HFPA, our regulator, the HFPA is our regulator and regulates all fertility clinics all over UK, and it produces figures called trends. And in 2023, which is the last set of figures that the HFPA has published, it shows that there were approximately 1,100 Caucasian egg donors registered in the UK, but only 65 Asian donors. And this is for 4% of the population, this is less than 10% will be provided for by these number of donors. So there's a big gap in the service where women or couples of Asian ethnicity are unable to find a donor that matches their ethnicity and is acceptable to them. So as a result, some of them may decide to accept a Caucasian donor, which is fine, but some of them will drop out, or some of them will then travel on their own to India or South Asian countries to see if they can identify a suitable donor for their treatment. And this is where we worry that they may find themselves in an unregulated environment. So safety is where we want to come in.
That's amazingly cute. Sorry, my throat is gone. So, can you tell me about like the journey? If somebody signs up with you, what's their full journey?
So, to avoid the pitfalls of doing this on your own, TMTC has got a very powerful, secure, collaborative pathway.
Yeah, they do.
So first of all, you will be offered a journey which is first of all tailored by the UK consultant team, and you will have your treatment in a UK vetted clinic in India, which meets the standards that I would expect for any clinic here. So safety and success is paramount. So you will have a consultation with myself or one of my colleagues here who will go through your medical journey and then make sure that you have a plan which is appropriate for you, which is the plan I would make for you whether you were having your treatment here or in India.
Okay.
It would be exactly the same standards.
Okay.
Once you have the plan made, you will then have a consultation with your consultant in India. So please remember that the consultant in UK is named and the consultant in India is also named. So you know them before you leave, and we have a very strong patient services team who will collaborate with you and listen to you and arrange all of this. So you're not struggling to make these appointments, we make them for you. Once you've had the meeting with the consultant in India online, and you're confident on your decision to proceed, we will then help you make your travel arrangements. We have facilities where you can stay, which are very well, and you will be very well provided for. You can begin your medications here, or you can begin them in India, depending on your needs. And then you have your treatment, and hopefully once all of that is completed successfully, you will come back to UK and you will come back to the care of your UK consultant. So there's no gap in the service. There's continuity of care, and you won't fall down in places where patients usually struggle if they've traveled on their own. Say, for example, in that case, it may be anything from up to 3 weeks. If you're having treatment with donor eggs, again, probably about 3 to 4 weeks. So I would think that depending on the treatment we're aiming for, it can be anything from 2 to 3 weeks to be. You may want to stay a little bit longer because you could start a bit of your treatment here before you leave, or you can have the whole length of the treatment there.
Yeah. And what's the feedback been like so far?
I think the feedback has been good. People really feel secure knowing that they're having a consultant with a named consultant in the UK. They feel secure that they know the clinics have been vetted by us. We have visited the clinics and we know the consultants who are looking after you. So I expect the same global standards, and that I think is very reassuring to patients. And we have, surrounding all of this, a really good patient services team.
Yeah. I mean, like I said, although not a fertility journey, I have been on a journey with you, and I have to say, the care and the dedication is next to nothing.
Really, and
even like the private chefs, like you're really spoiled when you go anywhere with TMTC, to be honest, and they do actually vet everybody very carefully.
Yes, and
they do really look after you. So I'm definitely, like, genuinely, like, an advocate for the company.
Thank you.
And
it means a lot.
Oh, bless you. And I think it's such a difficult journey to go on, when you're trying to conceive and stuff. And there's so much more to it. It's not just the practicality, is it? I think TMTC just feels like you're getting a big hug all the way through the process, right?
Perfectly explained. And it's like you have questions and you ask the questions and you get an answer directly. You don't have to struggle because the patient services team will be there every day hand-holding you through the journey, and you have the experts to help answer all your questions.
And what about after, like when you come back, like that whole aftercare, like at what point does it kind of stop? How do you navigate
when
that
you've
journey?
had your treatment completed, that means we call it in medical terms an embryo transfer. You come back to UK and you do your pregnancy test here, which we hope will be successful. You then have your early pregnancy scan with the clinic that we will refer you on to, and if all is well, the UK consultant team will refer you on, will write a letter to your GP confirming that you are now pregnant and should be referred to the NHS for antenatal care, so that that pathway is seamless. And this is the pathway that we follow in private clinics in the UK as well. So we will do exactly the same. If unfortunately it has not been successful, then you have a consultation, a follow-up consultation immediately with your UK team and the India team to discuss what the next steps will be.
Okay. And I do think genuinely you probably have thought of everything and every step of the way. But if you're in the UK, and I really encourage you to come to Hey Gorgeous and speak to the team directly.
Yes.
Obviously, you can reach out to them online and everything.
May I just say one thing?
Yes.
So it's just to say that currently we are offering everyone who wants to know more a free mini consult
Today, sorry.
And so you just have to call the TMTC team and they'll arrange for you to have a consultation with myself, I will then be able to say, yes, it's appropriate for you to consider going to India. We will then give you a treatment plan, an approximate treatment plan, and you will be provided with cost estimates about how much it will, because affordability is the other big thing that we have to highlight. That it is, we think, going to be a little bit more affordable than having private IVF treatment, particularly with donor egg. I think there's going to be a huge difference in the cost because I have worked here for a long time. And I know that the success rates are very good. It will be affordable. And so please do contact us if you want to know more. There's no charge for that. And we'll be very, very willing to speak to you to explain things more.
That's amazing. I'm glad that you told me that. So I think if you're considering or you're on this journey or you just want to know anything, honestly, with these guys, there's no obligation. There's no pressure.
No pressure.
Just have the consultation. See if it's something that would work for you, if there's any alternatives or, you know, different pathways that they can take you down to ensure your success and see, you know, what you can do, because it's really amazing that we have such, honestly, the hospitals in India, everywhere that I went, when I went with TMTC, I don't want to say this, but, you know, sometimes you think of India and you just like think that it's not kind of caught up technologically or anything, but oh my God,
no cutting
honestly,
corners.
Beautiful hospitals, amazing people, the speed of the care, like it was bang, 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 in and out. There was no like waiting around and none of that.
And the thing is that TMTC has been able to facilitate that. If you go on your own, you then get stuck in different points of the journey where you don't know what is being told is accurate or not. So I think the big advantage of TMTC is that everything has been vetted for you. Everything has been taken care for you. You just have to go through the journey for high-class medical care and overall hand-holding and a big warm hug all the way through.
Big warm hugs. That's what we're all about.
Especially with fertility. I think patients need that extra amount of emotional care, and I can assure you that this will be there in abundance.
Amazing. So make that call. How do they get in touch with you on your website?
So there is a website that you can go through, and there's an Instagram page that is their own. If you just look for TMTC, the Instagram page, the contact details are all there.
Okay, amazing.
And then we can ask someone to provide the link for you, if that's okay.
Look, it's back. I think I need to wind up now.
I
think my voice can't take it anymore, and sorry about my
That's all right.
sharp exit. See how lovely she is. Wouldn't you just want to work with her? This is who you'd want to be looking after you, I think.
I hope that you will come forward to have a chat. No pressure, just for me to be able to give you some advice, and you know, it's hopefully will be well informed, professional advice, personalized to your needs.
All right, guys. Thank you. Have a beautiful rest of the day. Fantastic weekend coming up. We'll see you at Hey Gorgeous. But please get in touch with Dr. Rima or the TMTC team if you want to know any more, you want your free consultation, you have any questions. And not just about fertility, actually, such a big range of healthcare.
Yes.
Hip replacements and this replacement and that replacement and implants
wellness,
and cosmetics and literally what can be done in India is phenomenal. So I think I saw someone today talking about like excess skin. You can do like tummy tucks and everything, can't you? I'm just sticking to fertility. Yeah, I know. So not you, TMTC. But seriously, just like explore
Yes.
the possibilities
Yes,
for your
there
health
is.
and wellness,
Yes.
and particularly your preventative healthcare, which is why I went. Okay, guys, take care.
Thank you for listening.
Bye.